I'm going to depend on you.
um, I'm just wondering, Avi, at the moment, when we can't really palpate, are you, you know, your patients that you're treating, are you just we'll probably have to just purely work on theory now and.
You can well, I don't know what the rules are in Ireland. I would say you can palpate. I just wouldn't do a huge amount of it. So first of all, I've only been seeing people that I know.
Yeah.
So I don't have to do too much. I haven't really seen any new patients. So I don't have actually I've seen somebody who was new and it was kind of a disaster. It's just the way I work is just too, it just doesn't work well for me. But I don't know what the rules are for you guys, but in the same way that you're taking the pulse, I mean, it's not like you're not touching the person. That's why there was this whole thing about, you should wear a mask and et cetera, et cetera. So I think you can palpate, but, since you don't want to, the question for me is more, I mean, I'm not sure you get the transmission is by you touching someone as much as you don't want to be in the room with them breathing for too long. So depending on your ability for palpation, if it's going to, because a lot of people at the beginning say, well, it takes me a huge amount of time, then that may not be what you want to do right now, because you don't want to be with the same patient in the room for too long, so you're both exposed, even though you're with masks, etc. But I'm not so sure, so yes, it's true that I've been doing a little less, I'm relying a little bit more on dogma and I'm confirming a little bit less, yes. But that's because these are people that I already know, so I can afford to do that. I'm not so sure how that would work for me with a new patient. I mean, the one I did have was problematic to, up front. It was someone who came officially for aphasia, but it's not aphasia as in stroke. It's aphasia that's basically a dementia that shows as aphasia. And it turns out there were a whole bunch of other cognitive deficits, et cetera. So it just wasn't, it was too hard to communicate to begin with. So it's an unfair, I might be able to work better with someone else, but there were a lot of disadvantages up front for communication. So I can't really say, but I mean, I don't know what rules there are in Ireland, but there's nothing that I know of that says you can't touch someone, because you're already not socially distancing, by doing acupuncture. It's not like you're violating extra. You're already in the same distance, and it's not like, there are certain diseases that transmit through the skin, through touching skin. Like if they had open herpes sores or something, but as far as we know, COVID is, whatever, something along respiratory, quote unquote airborne like, even though they're saying it's not airborne, but it's, it's still through, respiratory and or touch, you're not touching body fluids when you're touching the skin. So I don't know if, like, for example, the sweat secretes virus. I don't know if anybody even knows if they've bothered checking these things. But as long as you're touching, whether you're poking, just like you're touching to needle, and then you wash like your hands afterwards. Don't touch yourself after. Would be the only thing, but I don't think any of us really know or understand, have enough experience to be able to decide these things, in clarity.
And I think if you're genuinely worried about touch, there's no reason you can't wear gloves. I think you can palpate pretty well through a glove.
Yeah, it takes getting used to. But there are definitely people who do, like, Wendy wears gloves all the time because she has eczema, and she can do moxa, direct moxa with gloves. She does everything with gloves. No problem. you know, because she doesn't, I'm not so sure if her allergies, you know, some sort of, you know, eczema is some sort of allergy that she can get things from people or whatever, but that's how she works on a regular basis with gloves, always. You know, and certainly doctors do. So we're just not used to it, you know, but for me, I'm kind of like, you know, I'm okay, I palpate, and as soon as I'm done, I sanitize my hands with a spray so that when I, you know, touch the doorknob, I'm not overdoing, you know, and then I wash my hands. That's just me. I really don't know what the official line would be.
Yeah.
Anything else?
Just that we reminded me of you there, just as we were speaking about the scalp. um, Somebody that has like a really tender scalp in general, not from not from
Yeah.
bees. um, yeah, just a very tender and kind of sore scalp.
Hmm. What else? You know, I don't have any great dogma for it. I mean, first of all, the whole scalp,
Sorry.
the whole scalp, or a particular area.
Yeah, the whole scalp. Yeah. This person now would have autoimmune, probably the main thing.
Okay, so okay, so the tight scalp, the you know, the sensitive tight scalp itself doesn't ring any bells, with one exception, which is the so-called stagnant blood in the head. Spleen 6, spleen 9, pericardium plus lung 5. That's a possibility. I don't know. Usually we talk about it like do 20 area. But if they have an autoimmune disorder, I would start autoimmune treatment,
Yeah.
Ren4 plus kidney plus lung, and you know, and use the scalp as a reflex for, you know, so even though, well, if they have Crohn's, you won't do Ren4, but you know, you'll do side gallbladder 28, you know, instead. But um, I would use the discomfort in the scalp as a reflex
Okay.
and see if, oh, is autoimmune really important for you? Is stagnant blood in the head really important for you? Is you know, is thyroid, is whatever else whatever else you come up with as ideas from their past history,
Mhm.
see if if that idea alleviates the scalp, and just treat this as if that was a reflex, as opposed to a symptom that you're trying to get rid of, which of course you are. Um, but because I don't have like a clear, um, you know, sometimes when you see someone, you go, oh, okay, you know, they have some sort of congestion in the upper thoracic and that, or, you know, and that creates, you know, blood supply or something, but without actually having, you know, so just as a symptom for, you know, like just a stated symptom, the only thing that rings a bell for me, that's somewhat a similar bell, is the stagnant blood in the head,
Mm.
where they might have pain, a loose scalp, or heat around 220.
Mm. Okay, they just describe it as just soreness and tender.
Okay. To touch, or in general, or
To touch mainly, I think.
okay. And what kind of autoimmune disorder?
Rheumatoid arthritis.
Oh, okay. Okay. It's not very likely to be a, you know, you never know. Oh, there is a sort of arthritis, ganglia, something. It's, you know, it's also blood, it's something with the blood vessels, I believe, that does affect the face and the scalp. So that it could be, it could actually have a really, a clear, you know, rheumatoid, explanation to it. So I would go with that. I
Yeah,
would start.
I normally do that anyway.
Yeah, and it doesn't help.
Um, Probably helps for a while, I think, but comes back.
Yeah, so if when a treatment helps for a while and comes back, you have a few options to look at. Um, One is, well, it all depends. I mean, assuming you've been treating them once a week for, say 5, 6, 7 weeks, so they've had a number of treatments, and it's very clearly not stabilizing. Like they always say, oh, it's good for 2 or 3 days, but it keeps coming back, and over time, there's no clarity that there's a trend towards the better. I'm I'm missing something in the medical history. So I'm chipping away at something, but there's a large block that's not being chipped. So I'm addressing the autoimmune, but there's something else, another injury in the body. The body is preoccupied with something else. Therefore, it's not gonna, the autoimmune treatment is just never gonna take root because there's something else. Let's say they have low blood pressure, or let's say they have diabetes, let's say whatever else, something else is kind of still primary and is not being addressed. So it's holding up the body. Another thing is that they're holding the body themselves. In other words, say through diet. That there is some habit that they're doing that the treatment can counteract. So sometimes you just have to look at their lifestyle, and it's primarily I would be looking at diet. Like, if the diet is really like bad, then okay, listen, make an effort for say 3 or 4 weeks and clean it out. And let's see, and do the treatment during that time for 3 or 4 weeks, once a week. And then let's see if then the treatments are able to do it. Because sometimes, especially with something that's inflammatory, if you're doing a treatment, but they're basically keep eating inflammatory foods, that it's a little hard to get good results that way. Now, for some people, it will work perfectly fine. Food doesn't touch them, But for some people, a little bit of chocolate throws them off, and you just don't know how the person would be. I have a patient who, everything worked really well for a while, blah, 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 blah. And then, well, she was a kidney donor. So she came to me before, actually. And then after and after a few months after the kidney donation, she, it's like, oh, well, I survived this, everything is good. It's like I did what I wanted to do, and and kind of like, she tends to slide, and then she goes, oh, but I have all these pains in my joints now, and like so, and it's very hard to diet is very hard to work with because most people are not that motivated, and when they are, they have their own ideas. It's hard to, it's like, usually when I ask people, can you tell me what, about your diet? Usually the first answer, well, it's one of two. It's either, oh, my diet's very good, it's very clean. And then when I actually ask questions about it, okay, what do you have for breakfast? What do you have for lunch? What do you have for dinner? What do you have in between? Blah, blah, blah. It's like, oh, they forgot, or they don't even recognize. They're telling you how they're having the, whatever, sugary snacks, or, sodas or whatever. And it never occurred, they just don't consider it as part of their diet is very good, because yes, they have meals that look very good, but we have a few muffins here and a few this there and blah, 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 and some alcohol and, blah, blah, and altogether it adds up. They just don't they don't recognize until they express it. And even then they don't think about it, but I'm eating my vegetables. Yes, but with a bottle of whiskey a day, it may not work very well, kind of thing, Or the other answer is, oh, my diet is crap. And they don't have, like, from the answer, when a person tells you their diet is crap, they either recognize that they might be willing to do something about it, but usually it basically means stay away from my diet. I'm not here to get, to change my diet. I'm here for you to solve my symptoms no matter what I eat. So there is a certain percentage of people for whom their diet, or, in her case, it could be something like, maybe I'm just making stuff up, that she's playing computer games 13 hours a day. I don't know. And that can, I don't know, electromagnetic frequencies. I mean, I just don't know. But there could be some habit that's preventing the treatment, or the treatment is just not quite right for them. The treatment is touching the problem, but it's not addressing everything that needs to be addressed for the problem. So I go back to the drawing board and I go, okay, in the medical history, what else exists? What else can I come up with that might stabilize this better? Make sense?
Yeah. Yeah.
Camille? Sounded
Another one that I find is the use of electric heating pads and electric blankets, because that creates a whole other electrical field. And if a person is sleeping under an electric blanket every night, I mean, they're almost immediately undoing your treatment.
Yeah.
And I also want to corroborate just what you said, Avi, because I have I have patients exactly like that, where like a family member came to me and said, oh, well, she drinks a bottle to a bottle and a half of wine every day to, to self-medicate her pain, Oh, okay. I had one patient that I treated for 20 years and she never admitted to me that she was drinking a bottle of wine every day. Yeah.
Well, there was nothing to admit. It was, she just assumed that everybody else does it.
Well, whatever it was, but it was like, yeah, it was exactly that, where the first 2 years or so we did really well. And on all of a sudden we just stopped doing well and I couldn't figure it out. And that's when the family member told me that. So, yeah, you just never know what it is. But so I completely agree with what Avi has said.
Yeah, I would have never thought about electric blankets or that
They
affecting.
can, they can be for some people. This is the problem. It's just like with food. There are people who can drink as much as they want and eat whatever and smoke and whatever, and nothing. It doesn't do anything for them, at least not currently. And there are people very sensitive to it. And electric blankets do have, and this is what's so odd, is because there are not so many acupuncturists, but certainly a lot of massage therapists use electric blankets. Under the table sort of thing. It's extremely common. But most acupuncturists are sort of like, don't like the idea. But yeah, they can interfere. So, think about it. It's like, I was thinking of the video games, just like with a cell phone. If she's someone who's on a cell phone constantly,
Not
maybe
really.
she's, yeah, no, I'm just saying, maybe, and then maybe that person is more sensitive than they might have believed. So you just don't, the weird thing is you just don't know what part of their lifestyle or what part of their medical history is the determining factor.
Yeah.
And that's part of the experimentation that you go through in a treatment. And you see if they're willing to eliminate a certain or change something, and see if that's going to have an effect. The same thing that you're doing in a treatment when you're saying, okay, I think it's autoimmune. And then you go, well, but the treatment didn't produce very good results, even though they come with a letter from the doctor that they have, a very clear diagnosis with rheumatoid factor, et cetera, and you're doing the official dogma that's supposed to be, the books say that, they should get results. And then you go, okay, maybe I should treat something totally different. Because, oh, I see in your medical history you had a tailbone injury. By the way, tailbone injury might create this because they're two ends of the spine. And then you start treating the tailbone injury, and wow, everything gets better. It just, these things just happen. You just need to keep being willing to research. or maybe you kind of ignore the fact that she was taking birth control pills, or maybe you didn't even know. And then you go, fuck, it's like I'm gonna research, I'm gonna try addressing the birth control thing, so you do SMOICHSN3 or UB66, and and then they go, oh, this treatment lasted longer. It's a constant experiment. When after the first treatment, if they say it was better for a few days but didn't last, that's okay. It I don't expect the first treatment to solve the problem 100%. It's not, if when it does, it's very nice, but if it does, but if that continuously, if after 3 or 4 treatments, that's, and it's not taking better root, if it's always, I love coming here because I get 2 days of relief. I mean, okay, I'm glad for them, but it's not satisfactory for me. From a technical perspective, I feel something is lacking. So listen, and you can establish a great clinic by treating people where on clockwork every 3rd day they'll start having pain, so they have to come back to you, whatever, But no, I mean, it's not, I mean, sometimes that's all you can do, and that's acceptable. It's not like there's something, this is, but if you can, you investigate what can you do. There are also people that you can't, that will be coming to you their whole lives because you will not be able to 100% get rid of it, of the problem. They'll still come for maintenance. Okay, there are people come for a problem and it's resolved. You don't see them again for 10 years. 10 years later, they go, oh, by the way, you did a great job on my blah, blah, blah. And I don't remember who you are. I don't know what blah, blah, blah was, whatever. And now they're with a new problem altogether.
Yeah.
But there are also people who come on they have serious issues, and as long as they're doing acupuncture, or as long as they're doing something, it's manageable. It's they feel good with it, so they're willing to say come once a month, or they're willing to do whatever. I can't say you can cure everyone, you can fix everyone. So sometimes you can only push the envelope so much. I'm just trying to find out where is the edge of what I can push, and then I have to accept.
Yeah, the other major thing, I suppose, with this person is they had a kind of nervous breakdown earlier in their careers. So maybe the stagnant blood in the head might be something
It
too.
could be. I mean, I would look. Yeah. So what you might want to do, well, a nervous breakdown is a very it's slightly nebulous term because it can include many, many things. It's not like there's one definition of it, as far as I know, at least in my language. So yeah, look, for example, if she has REN 17 or REN 15 or T5.
Yeah, she normally has RIN 17.
Yeah, so work your strategy. So do the autoimmune and then look at the strategy of addressing. You can do stagnant blood in the head, but you can also, for example, see if start with the stagnant blood in the head. So for example, spleen 6 or spleen 9. But I would start with spleen 6 because spleen 6 has a stronger affinity to the head than spleen 9 does. Okay. Does it resolve REN 17? So at that point, you're starting out by ignoring the scalp, because now you got yourself an idea that says maybe a nervous breakdown is a core issue here. So you don't want to go against the head as a reflex yet. You go against, say, REN 17. If REN 17 is resolved, then you go in, by the way, how's the scalp? Okay. So I would start with the spleen 6. I would certainly, pericardium could be a very important component. And then Sanjiao 8. Either Sanjiao 5 or Sanjiao 8 could be very important for someone like that. And yeah, definitely check T5 in the back. Even though, as they're lying face up, you can still check around T5 and see if there's anything there. And again, so you're maximizing your ability to check things and quote unquote guarantee that they're working. You
T5,
do T5
is
heart level.
oh, right, okay.
right? So T5, T4, T3, and also the other thing is, so it's not just because they're emotional reflexes, because they are, but also because this is an area that holds up the head. So what happens is that the kyphotic area between the shoulder blades can affect the neck and the scalp also.
Okay.
Make
Great, thank
sense?
you. Yeah.
Oh, one more. I would also consider gallbladder 39 as an option for scalp issues
Okay.
in general. I mean,
Great.
it's more kind of a brain point, but it could be a scalp related.
Needled up.
Yeah, yeah. It's just, I always do. So yeah.
You know, and that's another thing that can really undo the treatment is if they have PTSD, or if they're in a living situation that pulls them back, like if they leave your office and they go back home and they're in a miserable marriage or even maybe an abusive situation, um, you know, that's going to bring the whole cascade back immediately. So you might have to explore it on a more psychosocial level.
Yeah.
And it's going to work really well when you tell them to, by the way, you have to leave your husband in order for the treatment to work.
Well,
No, I
well,
mean, it's a reality. Sometimes it really
it
is
is a
true.
reality, and
And it's just
sometimes
not always easy.
I mean, I don't know about you, but sometimes I do coach people in the practice in their, you know,
Yeah,
like,
of course.
because it's part of the whole picture of you know, of being healthy.
Yeah.
Yeah.
So,
Oh, no,
but
absolutely.
I also think there's really, I think you and I differ a little bit, Avi, in that I think, you know, you do get frustrated if you don't get breakthrough results, but I have people in my practice that have come back every week for years because they say, when I'm on your table is the only time I don't feel pain, or it's the only time
Right.
in the whole week that I get any decent sleep.
Yeah,
And to me, and you know, to them it's worth it. It's worth it to
sure.
come twice a week sometimes.
Yeah. No, I think I'm not, um, yes, that does, it certainly exists. You know, it's very common actually. I tend to do a little less of it than maybe most acupuncturists. That's a different story. But the thing, I'm not against it. I'm just saying I'm trying to see, especially at the beginning, because you know, when a patient has been around, when you have one of these patients and they've been, you know, this is the pattern. You both, I as a practitioner and they as a patient, have settled into this pattern, and it's part of their life. Okay, but before that happens, if I can break through the, you know,
Sure,
issue,
sure,
it'll be very
sure.
nice. And at some point you have to say to yourself, you know, I couldn't break through it, and then it's up to them. You know, do they choose to go try more modalities or different acupuncturists or whatever and try and break through? And some patients will not, because they're saying, I'm comfortable with you, I like you, this is, I'm okay with this, you know, and it's whatever is acceptable to them. There's no rule that says, um, after X amount of treatment, the patient must be better by X percentage. You know, if somebody could write a manual like that, and actually have it be true, that would be very odd. That's just not the way medicine works. Um,
Could I ask you other applications for the stagnant blood in the head treatment? What else do you use it for?
um, okay, so notice that it's a very similar treatment to blood pressure treatment. Spleen 6, spleen 9 pericardium is the same. Lung 5 is different. And in the case of blood pressure, I use under the third toe. So it is a treatment I use a lot to begin with. So it's officially, that official beginning of this treatment was, this is for postpartum depression. This is when, so, and the reason I'm telling you is that because, so you can start looking at what else is happening. So you have a damage in the lower dantian, you know, in the Ren 4 area. And remember, Ren 4 is called the gate to the primary Guan Yuan, and primary here is not source, but primary like the head over the legs. You know, the direct, what directs things, the brain, the head directs us in that primary in that sense. So when you have a damage from giving birth to the Ren 4 area, to the lower dantian, there is a flashing up, which maybe in TCM you'd call it yin deficiency, you know, heat rising, something like that, that reflects in the head. And that's, you know, and you get this postpartum depression. So the original treatment of this is for postpartum depression. But then when you start looking at, okay, when there has been a damage in the lower abdomen, and then there's an emotional and or a physical effect in the head, so that's another quote unquote application of it. And it's supposed to be when you have, you're pressing around do20, it doesn't have to be do20 exactly. You can take a certain area around it. And there's either when you press, there's pressure pain, or when you press, it you know, it's like a little edema. It feels mushy, soft. Or when you, not necessarily pressing, but you're touching, you know, and you feel heat around do20. So that's the official line of that treatment.
And what do you actually mean when you say damage to Ren 4? Can you be more specific there?
Not super, but okay. So when you're giving birth, you're basically, you know, you're pushing. Yeah, I mean, I haven't given birth, so I don't know, but I would imagine that one pushes, and you can be. I mean, besides the fact you can rip things, that there's just a whole slew of things that can happen. The area is no longer. It's just like someone beat you, you know, punched you in the gut.
I suppose
Except,
a cesarean section,
hmm?
C-section as well, I suppose, like you're.
I would, oh yeah, C-section definitely can create that also. Yeah. C-section will come with a slew of other problems on top of it. Okay, because first of all, you have muscles that are literally ripped, and then you also have it now. You conceivably have a weakness in the inguinal. So that's a whole other, now you have a possibility of things dropping down a little bit more easily. But any pregnancy can create to some extent, you know, any labor can create a certain amount of that to begin with. So I think any sort of havoc, trauma, or whatever in the lower abdomen that results in that afterwards you're seeing some sort of head symptoms, you can start thinking about stagnant blood in the head. You know, and you know, you can make a lot of ideas around it, you know, like, you know, is this a treatment that's addressing, you know, like second brain, first brain connection, blah, blah, you know, that I don't know. But there's definitely a connection between Ren 4 and the head, you know, practically speaking as well as theoretically.
What do you mean by second brain, first brain connection?
Oh,
What is
like
that?
gut, like the effect of
Oh,
bacteria on, you know, sorry.
oh, okay.
I
Okay, okay,
don't always speak the correct language. I know
okay.
there's like a common term for that, that the gut is a second brain or something like that. Is something equivalent to that?
Yeah. Now I understand what you mean by that. Okay. Can you elaborate on C-section then?
Oh yeah, I've had 3. No. So a C-section, basically you're cutting into the abdomen, and you usually you're cutting around the inguinal. Okay, they generally cut. I mean, there a few C-sections they'll do in the center below on, you know, on the Ren line, but most C-sections they'll do between stomach 30s. Okay, that's like the most common. But you have to understand that's where they're cutting. It doesn't mean, you know, they're not getting the baby, you know, the baby's not waiting, you know, but the baby's waiting, oh, I'm in Ren 2, I'm just waiting to be cut out. The baby is all the way up to Ren 15, so, well, maybe that's an exaggeration, but the baby is way further up. So the scar that you're seeing is one thing, and inside they went and ripped everything. They pulled everything. You know, they displaced everything, and then the baby comes out, etc. So you're going to have a huge amount of weakness, which is why most small hospitals will not let you go through a regular birth once you've had a C-section, because they're afraid that you'll tear it. And then they need to have like blood supplies. They need to have a facility that can accommodate a problem. If you had a C-section and want to have a regular birth afterwards, vaginal birth, smaller hospitals will generally decline you. So it's very interesting. For example, there's a hospital close, well, it's in Massachusetts, it's relatively close. It's a Catholic hospital, and they have like a huge percentage of C-sections. And it's because once you have one, they basically push you into the next one. And because it's a Catholic hospital, you know, it's kind of like they have larger numbers of births, but larger by same parent, and therefore larger number of C-sections, because once you have one, you kind of, it continues. But a C-section is definitely going to create a weakness in the lower abdomen. It's going to possibly pull on the inguinal ligament afterwards as a result. Well, it's pulling while it's happening, but it afterwards there may be a stronger effect. And it is conceivably, especially if you've had a few of them, it's so the way I would treat it is with stomach 13, okay, to lift and clear the stomach area. And to that, the supporting points for that are inner yin, gallbladder 26, and immune point. Okay, so a C-section can create a situation where things are going to start falling down. Okay? Now, sometimes that falling down will not happen until 30 years later, you know, when there may be bladder incontinence, something like that. But it's setting up a state, it's adding to the state, or it's setting up a state for the possibility of prolapse. But I would say, and again, I don't know, because this is really not, you know, labor is not exactly my field. I would say that a very prolonged and very difficult and I don't know if one would call it violent labor, but you know, a very extreme labor can do the same thing also, because there's a certain amount of pushing down that can create damage. You know, all the, you know, like you're pushing like hell, and you know, maybe, you know, depending on the strength of your tissue in the abdomen, which is already very stretched at that point, there's only, you know, at some point, you know, a woman can create havoc in damage also from pushing, you know. But what's the choice? You know, it's worse to keep the baby in, right? So you kind of have, you know, there is a certain amount of well, there's definitely trauma after giving birth. There's no question about it. I mean, there's been trauma before, you know, kind of a sustained stretching and, you know, et cetera, and then there's this huge period of like I don't want to call it abuse, because it sounds like, you know, I'm anti-giving birth, but that's not what I mean. But there's a very large trauma in there, and then all the tissue has to get adjusted. You know, you've just you know, you've been expanded a certain amount, you've had all this fluid and all this stuff that's happening, and then suddenly everything is out. There's, I mean, I mean, you know, just think of someone, say, just losing weight, which is not the same. If somebody, well, think about it as surgery to remove fat, and they took out, say, 15 pounds of fat from someone. That's a huge trauma. Does that make sense?
Yeah.
Yes, thank you. That's very interesting.
So, yeah, and I mean, that's why women, you know, after birth, it takes time, you know, and notice that some women never, no matter what they do, they never gain the same kind of body that they've had. You know, it's like there are women who very clearly had one type of body before birth, before giving birth and a different kind of body after birth. And no, they can still be athletic. They can, they're working on it. They're, and that's not just gaining weight. It's the shape of the body can change. You see that it's especially Indian women, like Hindu India. It's a very common thing that women who after they've given birth they are just much wider, much rounder. They have a very different body type than just before they were pregnant. And they tend to, for whatever reason, I'm not sure if there's a different hormonal cycle, that there's something hormonally that might be slightly different, with different ethnicities. But they're, they tend not to get slim. If an Indian woman had like the body of, like Twiggy or Tweety or whatever her name was, she's not going to look like that after birth. Whereas, some women, they were teeny skinny, blah, 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 and after birth, they're back to being teeny skinny, exactly the same. They never got any rounder except during labor. So it's just, every woman is different, but there are some tendencies. Some women tend to, have a more permanent change after labor.
Very interesting. Thank you. No
Sure.
matter where we start, we always end up in a very interesting place.
Well, the human body is always very interesting.
Yes,
It's like what can
fascinating. Thank
it's
you,
like
Avi.
there's always something that's odd, and we're very versatile in our capacities of doing
Yeah.
things as well as thinking about them. So
Yeah.
And we can
Lo-
never figure them out.
yes, exactly.
Yeah. Well,
All
lovely
right.
session. Thank you.
Thank you. Well, see you guys next Monday. And in case you're not aware, on Sunday, I think it's at 11 o'clock, I thought I would have a session for acupuncturists to just talk about how they see the profession or themselves or whatever, given all the changes that are happening due to COVID. So it's not a political meeting. It's not like to discuss, how we change the insurance policies or whatever, but just, to go through what are we as, people who are, like we're working with people, we're touching them. What is it like to do that post-COVID? What is it like to be either unemployed or underemployed or whatever it is that comes up for us? And for some of us who are like looking, is this my retirement, for example? So there's so many things that are coming up for people. So if people want to share, vent, whatever, it's there.
Thank you.
Thank you, Avi.
All right. So enjoy your week.
See you next week, Avi. Thank you so
Thank
much.
you.
Yeah.
Bye.
Bye.
Bye.